Hello everybody, it's me, Dr. Sandra Lee, aka Dr. Pimple Popper. Today I'm gonna answer a question that I get more than any other question, and it's how to properly pop your pimples. I'm gonna be like every other dermatologist and say, please do not pop your own pimples. And this is because there are certainly risks for infection, bleed, permanent scarring. But I know that a lot of us can't keep our hands off our pimples and we are compelled to squeeze them. The problem is that oftentimes we squeeze them too early, and this just makes things worse. It makes the pimple angry and it really hurts. You can watch plenty of videos the wrong way. People coming in with dirty fingernails, non-sterile instruments, just squeezing really hard. Sometimes people use their knuckles and that just makes me cringe. And please don't drink and pop either. Like, don't have a big swig of beer or wine and just start running around chasing people and trying to pop their pimples. Tell me the truth, guys. You all probably have a story about when you've tried to pop a pimple and you know you shouldn't, or it was a really bad idea. I want to hear from you in the comments. Look, I know that a lot of us can't keep our hands off our pimples. They sort of beckon to us. So I think it's my responsibility to explain the most ideal time to pop, to really make sure that we decrease the risk as much as you can for infection and bleeding and permanent scarring. So my mantra, if you've heard it before, is know when to pop and know when to stop. The best way to really address popping a pimple, most importantly, is to know what part of the life cycle of a pimple you're in. If it is too early and you squeeze a pimple before it really becomes a head or comes to the surface of the skin, you're probably gonna make things a lot worse. That pimple is gonna get bigger and angrier and actually end up being a much bigger deal. Usually when you squeeze a pimple when it's too early, you're gonna make things a lot worse. And also know that the deeper something is under the surface of the skin, the more risk you have of potentially scarring. So the most ideal time to pop a pimple is when it is the most superficial in the skin. That's the most superficial part of the life cycle, I would say, of a pimple. And this is what most people call a whitehead, but technically it's actually called a pustule. Things that can help to bring a pustule to the surface more quickly are going to be warm compresses to the area, taking a warm shower, even a steam. These will help to soften the skin too. So you want to wash your hands, of course, maybe even use gloves if that makes you feel more comfortable. And that can provide a little traction too. And then if you have any kind of instrument like a comedone extractor, which is what I use, you really want to make sure that it's clean, wipe it well with alcohol. Or if you don't have a comedone extractor and would like to use your fingers, make sure you have clean fingernails. Maybe even wrap a piece of tissue paper around your fingers, and that's going to provide a little traction as well. One really important thing is to make sure you set a time limit for your squeezing. The more you squeeze something, the more inflammation, and sometimes you try to squeeze something that can't even really be squeezed and you're gonna traumatize your skin. So really, if you are prone to this and prone to spending a lot of time focusing on your skin and in one area, maybe set a timer, 30 seconds, 60 seconds, to tell you to please stop and use a pimple popping patch afterwards to really keep your hands off the area so you won't squeeze it anymore. So like I said, know when to pop and know when to stop, know when to walk away. After I have popped a pimple, I really like to put a little spot treatment on the area, maybe a little acne medication with benzoyl peroxide or sulfur or salicylic acid, and this will help to keep the area clean, free of bacteria, but also help you to keep your hands off the area. Even better is to use a pimple patch, a little bandage that kind of helps to treat the area, but also helps to keep it covered and helps to keep your mind off of it. So I've seen a lot of things in my pimple popping days, but I am sure that there are some other stories to be told. So tell me, what is your craziest pimple popping story?